praying, and together we will get through this. Now, tonight we will be discussing the state of the health sector, and we are very pleased to have with us tonight Dr. 𝗧𝗛𝗃 𝗛𝗘, the Honorable Member of Parliament for 𝗧𝗛𝗏, who is also a medical doctor and very well known in the field. So certainly qualified to give us an analysis of the health sector tonight. To set the stage for our discussion, I want to read an excerpt from a press release that Dr. 𝗧𝗛 had done in October this year. I quote, "In addition to the numerous woes that citizens face on a daily basis at our nation's health institutions regarding drugs and supplies, we are now witnessing the fallout from failed, absent preventative maintenance on the aging infrastructure at some of these facilities. Despite spending billions of dollars in the health sector since 2015, this government continues to fall short when it comes to providing satisfactory health care for our citizens. Whether it is long waiting times for beds, surgery, or clinic appointments, or shortage of drugs and essential supplies, the government continues to fail us. Now we are seeing that they are unable to prevent flooding, even in our nation's hospitals. Whilst the Minister of Health continues to boast that his government is providing first-class health care, the experience of ordinary citizens and patients on the ground tells a different story. It is a story about pain, suffering, and frustration. Urgent action is required to stem and reverse this decline in the health sector, but it is obvious that the current Minister of Health, and indeed the current government, is incapable of doing this. It is sad that 7 years on, and after more than $35 billion expenditure on the health sector, this is what patients in our hospitals have to face." End of quote. So with that in mind, some of these specific issues that we want to address tonight would be things like inadequate beds, staff, drugs, supplies at the nation's hospitals, the long waiting times for beds, surgeries, even being able to see a medical practitioner, and the long waiting time for appointments, the aging infrastructure at the hospitals and different health facilities, and also the lack of preventative maintenance. Right, time permitting, I mean, there's certainly no shortage of topics that we could talk about under the health sector, but time permitting, we'd also like to get into COVID, maybe mental health, and the impact of the non-implementation of the procurement legislation on the health sector. So I would like to say a special welcome to our panelist, Dr. 𝗧𝗃𝗃 𝗛𝗘 tonight, and thank him for joining us. I would also like to say welcome to you, our viewers who are here connected to the Zoom and also on Facebook. I believe we are live both on the Campus Foundation page as well as the UNC pages. I would also like to welcome the members of the media who've been joining us, and also the members of the Campus Foundation. And of course, last but not least, my two co-moderators, the Treasurer of the Campus Foundation, 𝗧𝗛𝗏 Ali, and our very dynamic PRO, Mr. Chris Hussain. So we do want to end. I know we started off a little late. Sorry about that. There were some technical difficulties, but we will try and end at 9, maybe go probably just a little 5 or 10 minutes beyond. And we are going to have a Q&A session as well as a very short open mic session for anyone who wishes to make a contribution. Right? I know many people would be passionate about the health sector. It is certainly one of the most important things in the country. So I'm sure people would want to express a few opinions on the topics tonight. Without further ado, let me pass you on to our Treasurer, 𝗧𝗏, who will introduce Dr. 𝗧𝗛 and get into the panel discussion.
All right. Good night, everybody. Good night, Dr. 𝗧𝗛. Very, very nice to have you on board with us tonight. If I really read the bio for Dr. 𝗧𝗛, it'll take about 5 minutes. So I kind of summarize it in 3 lines. Very, very proficient and well-known medical doctor, former chairman of the Southwest Regional Health Authority under the PP partnership government, and current MP for 𝗧𝗏. Very hardworking MP at that. Dr. 𝗧𝗛, thank you for such great representation for your people. So what I would like to open with is this. There's a saying that the state of a country's health system or health sector will give a good idea of the overall state of their well-being of society, well-being of society, economic picture at that moment in time. Some people use the robustness of the health sector as a guide or as a measure to measure the progress of that society. So having said that, boy, Doc, the first question really and truly, we just came out of a pandemic where thousands of our citizens died, unfortunately, and condolences to the families of the COVID victims. But jumping straight into the question, this government would have pat themselves on their back, MP 𝗧𝗛𝗛 and the Prime Minister, stating that they handled the COVID very well. And as a matter of fact, there was a rumor when COVID now came out that they were first in the world through some study, some Oxford study that we can't seem to find up to now. But what are your thoughts on this whole COVID management by this present government? And do you have anything to say, like with respect to the amount of victims that would have passed away under COVID? Could it have been reduced if alternative or different strategies were utilized?
So thank you, Safraz, Nisha, Chris, and thank you for the opportunity to be on the Compass Foundation and to commend you on these critical conversations. I also want to reach out to those citizens who are experiencing very difficult times with regards to the inclement weather and the flooding and so on. And time permitting, I'll come back at the end and maybe proffer some advice with regards to the health aspects of floodwaters and so on. But be that as it may, Safraz, you hit the nail on the head in terms of the importance of the health sector and the health, looking after the health and well-being of any population. And that is reflected in the budgetary allocation, where you would have national security, education, and health comes in around third. So truly, really and truly, we spend about 6 billion per year on the health sector out of the 40 plus billion annual allocation. And therefore, under this government for the last 7 years, we would have come up with close to about 40 billion expenditure. And therefore, the question that arises in the minds of many citizens is, are we getting value for money? And we seem to have a dichotomy because the Minister of Health, seems to be always, patting himself on the back and talking about the wonderful job that he's doing in the health sector. But the story on the ground is completely different. On a daily basis, we have ordinary citizens, who will tell you a different story. And we'll come back to treat and deal with some of those issues and so on, and what the problems are. But to address the issue of COVID and the COVID pandemic, Safraz, and again, I would again want to extend condolences, of course, to all those families who would have lost loved ones. And of course, we would have crossed over 4,200 deaths. There is a lot to be said for the management of the COVID-19 pandemic. And despite the fact that this government would have us believe that they did a very good job, I think the evidence speaks otherwise. And the evidence really and truly is in that report is called the 𝗧𝗛𝗛 report, which was a report that was commissioned. We had the government dragging and screaming to finally have a report. So a committee doing a report. Of course, having a committee as opposed to a commission is different. Commission would have more powers and so on. But the committee did, in fact, do a report which was published under the chairmanship of Professor 𝗧𝗛𝗛 𝗛𝗘. And that report has some very worrisome findings. It is something, and in fact, it reflects the fact that the care that was provided for COVID-19 patients may not have been optimal and may not have been adequate in many instances. And there are some sentences, there's some paragraphs and so on. I have the report in front of me. It's a big report. Obviously, I can't go into details, but there's some very worrisome things about this. Now, how did we treat with the COVID-19 pandemic? As an opposition, the first thing, this was raised in early 2020. You would remember, I sit on the Public Administration and Appropriations Committee, And that matter was raised with regards to the government's preparedness for the COVID-19 pandemic. This is way back in January of 2020, before it was declared a public health emergency by the WHO. And of course, during in the parliament, you would recall, and the population will recall, that we tried to raise this matter, and several times my colleague, then member of parliament for Caroni East, would have attempted to raise the issue several times. As an opposition, the honorable leader of the opposition, very early in the discussion, suggested and offered a help as the opposition to meet with the government. You may recall that. And in fact, we did have a meeting, the leader of the opposition did have a meeting with the Prime Minister, and a delegation of us, including myself and Dr. 𝗧𝗛𝗘 𝗛𝗘, met with the Prime Minister, and we offered a document. It wasn't just a meeting, we offered a document with very valuable suggestions and so on. Some of which the government took up but never gave credit, but it wasn't for us to get credit. It was really to make sure that we were prepared to deal with the COVID-19 pandemic. You know, the situation, and again, I have to come back to this because we were in a fortunate position in terms of the institutions and the infrastructure to deal with COVID-19. You know, we need to reflect a little bit. If you remember, the institution that bailed us out and would have saved many lives that was already available was the 𝗧𝗛𝗘 Children's Hospital. And I will talk a little bit more about that. But I mean, you know, as we say, it took a pandemic for that hospital to be open. And was that facility not available, then one shudders to think what the outcome would have been for COVID patients. But more than that, again, this is important to point out because the 𝗧𝗪 Hospital is also used as a COVID-19 facility, if you remember, in the early days. And that 𝗧𝗪 Hospital was refurbished in 2014 when there was a threat of an Ebola epidemic threatening the world and could have reached Trinidad. And under the partnership government in 2014, refurbishment was done to that hospital and the Augustus Long Hospital as well. And those turned out to be very critical facilities, additional facilities in terms of managing the COVID-19. So, you know, despite the fact that the present government and the present minister had all of these facilities, infrastructure already available, the question really is whether the staffing, the appropriate and adequate staffing was provided to deal with COVID-19 patients. And also, more importantly, whether the drugs and the appropriate medications and so on were available. This report, the 𝗧𝗛𝗔 report, has some very damning findings. And what it turns out to be, they categorized it, when they looked at the deaths, and there were over 4,000 deaths, they categorized the patients in terms of mild, moderate, and severe. And it would appear from this report that the patients who ended up in the ICU may have not gotten the most adequate treatment in many instances. Now, I'm not saying that persons would not have died from COVID-19. We have to admit and acknowledge that overall the world faced a very challenging time during COVID-19. And in some of the more developed countries, there were deaths as well. But the question really is whether enough was done in our situation to deal with it. And I, as a medical doctor and as a member of parliament, representing the interests of the people and shadowing the health sector, in my own mind, I am not pleased that that enough was done to minimize, you know, morbidity and mortality in terms of treating the COVID-19.
Well, Doc, just a follow-up with that, right? There were problems to get vaccines and so on. Are you pleased with this whole vaccine issue that I remember in the beginning there was a private sector company that offered the government to bring in the Pfizer vaccine, and the government refused. And they waited on the COVAX system, and that took a few months. Any comments on this whole vaccine management that they put in place and with the procurement and so on?
Yeah, so I think one of the problems is that this government did not understand the need to prepare properly and adequately for this pandemic, which was hitting the world rapidly and spreading rapidly. In terms of their vaccine procurement efforts, a lot left to be desired. In fact, you remember the honorable leader of the opposition, when she realized that there was delay and there was no definite intent on behalf of the government or effort to procure vaccines, took it upon herself to write to the government of India seeking donations of vaccines, which the government of India were giving out to other countries at that time. And in fact, the first set of vaccines that were available to healthcare workers in Trinidad would have come from that donation via the government of Barbados. Again, when the questions were raised in the parliament, I mean, there were issues that came about with regards to vaccines internationally, and of course, some of the smaller countries suffered and so on. But there are ways and means that you have to be able to find the vaccines to protect your own population. And I don't think that the government made the proper effort to do that. And, there's another issue which the population may not be aware of. In 2020 is when the pandemic hit us, and in December of 2020, thereabouts, the vaccines were developed and were becoming available. In February of 2021, last year, I attended a meeting which was convened by the University of the West Indies in conjunction with the Ministry of Health. And I was invited to that meeting as an opposition MP and as a medical doctor. And at that meeting, a paper was presented by a university lecturer where a survey was done of the population of Trinidad and Tobago, asking how many people will take the vaccine. Because as you remember, after all the efforts to procure the vaccines, there was the issue now of the vaccine hesitancy. And the question has to be asked, how did we arrive at that situation? But that situation was known when that paper was presented in February of 2021. And it was reported in one of the newspapers. I've spoken about this before. It was found that there was about only 21% of the population who were willing to take a COVID-19 vaccine. So the question that needs to be asked is, in view of this information that was available to the government, what efforts were made to sensitize the population, to educate the population, and to motivate the population so that when the vaccines arrived in the country, that the population would have been better prepared to avail themselves of this vaccine. A whole 6 months went by when nothing was done in terms of communication. And I often ask myself, what was the role of the Ministry of Communications? There's a Minister of Communications. You may not know that. After sometimes the population may not know that because the communication from this government is so non-existent sometimes, But that would have been an ideal window, that 6 months before the vaccines arrived, to educate the population. So to me, it was no surprise when the vaccines arrived. And many citizens, because of lack of education, lack of information, decided and took it upon themselves not to take the vaccine. And of course, that was to the detriment of many of our citizens. But again, I put the blame fairly and squarely on the government for not making the effort to sensitize the population to get these vaccines.
MP, I'm listening on and I'm getting flashbacks to the pandemic. And we all listened on as a nation intently to those, I think it was the Sunday press briefings, if I'm not mistaken. And it was interesting because you're absolutely right about the communication and the messaging. Because I recall 2020 was a time when there was an election. And so you heard a lot of political rhetoric and banter. You all would recall the dome and sunlight and all of those different things, a lot of gaslighting mechanisms used. Do you think that because of those things that were used and used as political tools to win a political argument, maybe perhaps that is why the citizens didn't really take them seriously when they would have come with serious conversations as it pertained to handling the pandemic?
Yeah, so Chris, that's a good point. And when I reflect about the period prior to the August 2020 election, again, I have concerns in terms of, very serious. There were serious measures taken. Of course, the world didn't really know what was happening, but one could only look at whether the government went overboard in terms of stymieing the rights of citizens and so on. and kept the numbers in order to call the election. There is a point of view which suggests that that was a line that was taken. And you will recall that right after the election, the numbers started to spike in September of 2020 and thereabouts. And of course, we had that big spike, the numbers in January of 2022. So yes, you see, you have to be serious. And, you know, the sad thing about all of this is that the government choose, and perhaps for political reasons, not to work with the opposition. This was a national crisis in the making. And this is a situation that required real leadership. And I think the PNM government and the Prime Minister failed in terms of the effort that was required to work with the opposition, you know, for the good of the country. So they use those, they choose to use the differences, as you said, Chris, to make it a political battle to separate us from them, when in fact that was not required. And in fact, you know, we were there, we were willing. My colleague, Dr. 𝗧𝗛𝗘𝗛𝗘, current member of parliament for 𝗧𝗛𝗪 Manzulina, himself was a vaccinator. So they came about saying that we, the opposition, was against vaccines and so on. That is furthest from the truth. In my own constituency of 𝗧𝗪𝗧𝗪, when the vaccines became available, I held a clinic, you know, to make it easier for those living in the rural communities and so on to access the vaccine. And many of my colleagues in the opposition did the same. So to say that, you know, we in the opposition did nothing to help the battle is absolute nonsense. You know, they have chosen, and I want to clear the air on this, you know, they have chosen this point about sunlight and so on, and they try to cast aspersion and blame on the leader of the opposition. And this is the kind of politics, unfortunately, that we are faced with in this country. You know, there are papers, I mean, I don't need to go down that road, but, you know, there are papers which suggest that, you know, that staying out in the outdoors and so on would have had some benefit, you know, but they choose to focus on a few points that they make all the time, and they refuse to acknowledge the efforts that we made and the hand that we were prepared to lend to help in the fight against COVID-19. And the refusal of that offer would have been purely for political reasons, as you are alluding to, Chris. And that is unfortunate, because it means that the citizens of the country lost out from the expertise that the opposition would have been able to add to the government's plans.
And I think in times of crisis, especially in the sector of health, you want to be taken seriously. So I find, even though politics, you know, would have that particular, there's space for that banter, it's a given, but I felt as though health in the time of a crisis, that is not something you toy with exactly. But we would have seen during the pandemic, there was a direct link between the health sector and the social safety net. Now, the National Health Service in England, they compiled a report, and I read the report in preparing for today, and they said that there's a collaborative approach can improve communication, save time, reduce duplication of efforts, improve working relationships, and provide a better experience for people who use health and social care services. My question is, do you think that our health ministry and our Ministry of Social Development is really working collaboratively? And if not, what can they do to, you know, really assist Trinidad and Tobago so that we get the, you know, the value for money, as you were saying in the beginning? Yeah,
it's a very important point, Chris. And in fact, I did some of my training in Northern Ireland, and in Northern Ireland, they have something called the DHSS. That's the Department of Health and Social Services. So at the very highest level of governance in the UK, in that part, as you know, Northern Ireland is part of the United Kingdom, at the very highest level of governance, they link health with social services under one heading, simply because of the importance of linking the two. And of course, we have that disconnect here. You know, under this government, one hand is saying, one hand is doing something, the other hand is doing something else. So there is a disconnect, and that was very obvious. And that is something that needs to be corrected, you know, as we go forward. And the whole issue of cooperation and collaboration in the health sector is not for politics. You know, when I became chairman of the Southwest Regional Health Authority, I remember at one of my very first meetings, I invited, together with the members of the board, I had the whole management team come to a meeting, and I took them out and we looked at the hospital. I say, listen, I say, whatever we do here in that hospital will benefit we're doing it for ourselves. What did I mean by that? I meant that it was important to make sure that you had all these services, all the resources, because any one of us in the population may have to visit a health facility at any time. And therefore, that is why things like health, education, and so on, they are not sectors that we need to play politics with. And unfortunately, this is a government, that has chosen the health sector to play politics with. And we see it, and the most blatant form of politics was played with the 𝗧𝗛𝗘 Children's Hospital. It is an atrocity. It's one of the greatest atrocities that was thrust upon the citizens of Trinidad and Tobago. I have said this before, and I will continue to say it, because in August 2015, in fact, on the 14th of August 2015, when the Honorable Prime Minister, then Kamla Prasad Bisesa, commissioned that hospital, as the chairman of Southwest, I was directly involved in working with UNICOT and the Ministry of Housing at that time for the equipping of that hospital and so on, and signing off and so on. So I am telling you, and I can tell you without fear of contradiction, that hospital was completed, it was fully equipped, and all it required was what you call the operationalization process. In other words, all that was required was a few months to get things working and to get things in place. And of course, that would have created 2,300 new jobs in the health sector. But it is sad that this government chose to leave that hospital for 5 long years, right? And the only reason that it was open is because of the pandemic in 2020. And the population must never forget that throughout those 5 years, whenever we ask about it, the Minister of Health will jump up and say it's a construction site and laugh and so on. Laughing, thinking he's laughing at us. He wasn't laughing at us. He was laughing at the population who was suffering. And in a mere 2 or 3 weeks, they were able now to open the 𝗧𝗛𝗘 Hospital for treating COVID-19 patients. So the population must remember that. They must never forget that. And they must ask themselves if, in fact, that was really a construction site, how it was that the government was able to utilize that facility so quickly within a matter of weeks. And I think that's something that the population should never forget. It is one of the atrocities that has been perpetrated on the citizens of Trinidad and Tobago in the health sector.
Do you foresee the government putting their political pride away and really opening the 𝗧𝗪 Children's Hospital in the near future for the intended purposes?
Well, again, that is something that we are keeping on the front burner. I did, in fact, ask a question a few weeks ago in the Parliament as to what would be the future use of the 𝗧𝗪 Hospital. Now, the answer that was given by the Minister is that the 𝗧𝗪 Hospital now falls under, there's a special purpose company that was designed to treat with the 𝗧𝗪 Hospital. It's now a joint venture between the University of the West Indies and the government. The government apparently is a minority shareholder in all of this. But at the end of the day, it was built, to treat patients. It was also built to encourage and so on for medical tourism. It is the only hospital in Trinidad and indeed in the Caribbean that has a separate emergency facility for children. Whenever you drive past the hospital, you'll see there are 2 emergency entrances. One is for adults, the other is for children. So it would be a great tragedy if that hospital did not come back for the benefit and the use of the ordinary citizens of Trinidad and Tobago. But we'll wait and see.
Okay, I see Alim has his hand up, but Alim, we just want to ask a few more questions before we take comments.
What I wanted to do is to ask a question based on what Dr. 𝗧𝗪 said just now, because I was fortunate to be one of Dr. 𝗧𝗪's colleagues on the North Central Board, and we work very closely together. The question I want to ask Dr. 𝗧𝗪, Dr. 𝗧𝗪, you remember when the hospital was being going to be put in place, that was supposed to be under the ambit of the Southwest Regional Health Authority, which that falls in that area. How it is that what was done by the government, was it an illegal act to put it under the University of the West Indies and have the CEO of the North Central Regional Health Authority in charge of the very hospital that was supposed to be under the Southwest Regional Health Authority?
So, Alim, that's a very good question. If one looks at the location of the hospital geographically, it falls naturally within the remit and the boundaries of the SWRHA. And in fact, it was intended to remain under the SWRHA. The fact that they choose to put it under the NCRHA is an anomaly in itself, and it speaks of politics. And as you mentioned, the CEO of the NCRHA, Alim, the question that still needs to be answered is how come? And how can it be justified in the middle of the pandemic that 15 very well-trained and experienced specialists were moved from that Cuba hospital, which was then the mainstay of treating COVID patients, and they were rotated. And those doctors came about and said all the reasons that were brought about by the NCRHA administration and the CEO about the need to be rotated and whatnot. That's nonsense. I'll tell you as a doctor, when you're in a crisis, right, you find the energy, you find the strength, and you're able to work until you fix the crisis. And I can tell you every single one of those doctors would have preferred to stay in that hospital and continue serving the people of Trinidad and Tobago. And they would have had the most experience at that point in time. Because remember, the experience with COVID-19 was new. And therefore, again, it would have been a great injustice to move those doctors and to replace them, with the greatest respect to my colleagues and the new ones who would have come there, to replace them with those who did not yet have the experience. But again, that points to the politics of what was happening in the health sector, with a move to have the NCRHA and by extension, the blue-eyed boy, the CEO, oversee things. Of course,
no.
Sorry, go ahead.
No, continue. Sorry.
No, I was saying, Alim also asked a question about whether it is illegal for the government to put it in the UE. I mean, a government can choose to do what they want with the facility. But at the end of the day, there must always be transparency, accountability, and value for money. And that's a big investment by the taxpayers of Trinidad and Tobago. And, we have to ensure, and we in the opposition will continue to try to ensure that people benefit from that facility. And it comes back into the public sector.
Okay, sorry, go ahead.
Can I ask Dr. Bodo something? Will a UNC government revert the Cuba hospital under this SWRHA? Well,
I mean, I can't speak for what the government will do. What I can tell you is that the policy of the UNC and the policy of a UNC government will do everything in its power to ensure that the people get value for money and get service. And certainly, a UNC government will not allow a purpose-built facility to lay idle. So if you want to read between the lines there, Alim and listeners and viewers, the answer is yes, we will make sure it happens and that the people benefit once again from that hospital.
Okay, I want to turn the attention now to some of the frustration that a typical citizen would endure when they go to a hospital in Trinidad and Tobago, right? And I can tell you from personal experience of family members and friends who have been warded at hospitals or tried to get warded, that you would go into a hospital and you have to wait hours to get a bed, sometimes even more than a day to get a bed. Basic supplies like gauges, painkillers, sometimes toilet paper, ice. The hospitals don't have it. Now, you said, Dr. Bodo, I mean, we all know billions of dollars are spent annually on the health sector. So what is accounting, in your opinion, what is accounting for these inadequacies and inefficiencies in the health sector? And how do you think they can be addressed?
The short answer is poor management. But let us go back a little bit here. And this is like deja vu for me. In 2010, when we took up government, like the hospital was in a similar state where you had shortage of supplies and so on. In fact, the San Fernando Hospital really is an old facility and really needed to be upgraded. And that is the reason in 2010, 2011, when the Prime Minister then realized that, listen, something had to be done about San Fernando. A decision was taken to convert the unfinished building on Chancery Lane into a hospital, and that is the San Fernando Teaching Hospital, which added 230 beds to the current San Fernando Hospital. Now, that hospital was, that conversion was completed, and that hospital was opened in 2014. Now, that went a long way towards alleviating the stress and the bed shortages and so on. In addition to that, there were systems that were put in place to do what is called bed management. You know, there is a science to managing beds and ensuring that, you know, that patients can get beds and so on. You know, you calculate the average time a patient would stay, sometimes 4 or 5 days and so on. And you can work it out if you do the proper bed management. So those policies seem to have fallen by the wayside. And it would appear that the boards which are responsible for managing these RHAs, because in the health sector, the Ministry of Health is responsible for policy, but the RHAs are responsible for delivering services. And really these services and the performance of the facilities and the staff in the facilities and so on becomes the responsibility of the Board of Management. Of course, reporting back to the Minister of Health was the ultimate responsibility. But if you choose the wrong people to put on your boards in the first place, then you're going to have these problems. And it comes back to poor management. And in the last 2 or 3 years, it has also come back to lack of resources. There is a line item in the budget called drugs and supplies. Up to about 2018, when we left government in 2015, that line item was $600 million. So that is a line item that is used to procure things like goods and supplies and so on, right? Interestingly, around 2019, 2020, that line item was reduced from 600 million to about less, I think just under 200 million. When the question was raised, again, the answer was not very clear. There's something came up about taking a loan from NEPDEC and so on to try to complement the deficiency. But I am thinking that because of the limited resources in that area, that might be one of the issues. The other issue is the infrastructure. Now, when the San Fernando Teaching Hospital was built, the plan would have been to refurbish the old San Fernando Hospital. Unfortunately, this present government has not done that. And in fact, they have allowed the hospital to fall into further disarray. In fact, you would have seen the basis of my press release, we should have quoted at the beginning of this session, was really to speak about that video that went about with a patient on a wheelchair being wheeled through floodwaters in the corridors of San Fernando Hospital. Very ironical picture, you know. I mean, with a nurse, you know, having to piggyback on an attendant and so on. And I mean, that is really not something that you would expect to see in any modern health facility in this country, but it speaks as to the lack of maintenance and so on in the health sector, which we see has been happening in all of the sectors in Trinidad and Tobago. We don't need to talk about the roads and so on, you know, but it reflects, you know, a kind of attitude of this government in terms of, you know, preventative maintenance, you know, and taking stock and being proactive rather than reactive, as we see in many instances.
No, I looked at the Denmark health system, and it's not that I'm comparing the best to Trinidad and Tobago, but you know, we must be ambitious, right? We must be ambitious, and we must look to the best to at least try to emulate it. Even if we're 50% there, I think we'll be in a better position. And the basic principle of the Danish welfare system or health system is that all citizens have equal right to social security and the health services. My question is, does our citizens really and truly have access to quality health services? Because earlier on, I think Alicia mentioned we're getting to the services, you know, perhaps you maybe call the ambulance and they don't come on time, or you're not getting a bed, or medicine is not available. And it's very easy at times to always say, well, the PNM incompetent, they know good, X, Y, and Z. But what can we do to fix this? I know you alluded to management, right? Could you elaborate a bit more on that in terms of the managerial aspect? Because it seems as though we're having a managerial issue, maybe a HR issue.
Yeah, well, there's certainly an issue of management. And again, Christian research is online because the Scandinavian countries are known for the quality of healthcare. And you mentioned Denmark, of course, and they have excellent health systems and so on. But our problem here, so we spoke about the resources, and you also have the issue of the management of the resources. Now, one of the factors, and in today's newspaper, I believe it is the Express, is an article where the Minister of Health is quoting and saying that Trinidad is a sick population, meaning that there's a lot of chronic disease in the population, and that he's going to do the ministry is going to do some sort of survey. Now, this is not news for us. This is something that has been known. And in fact, again, during our time, there were policies that were put in place to try and treat and deal with the chronic disease problem. So it's an issue. It's an issue of management. It's an issue of boards and high level management, CEOs and so on, being proactive and being able to ensure that the resources are utilized properly. But there's also the issue of human resource shortage in the health sector that is not being addressed in any meaningful way. As we speak, we have a shortage of nurses in the health sector in a big way. And as you would have seen recently, nurses have been promised all sorts of things, and whether that has been delivered is open to question. Many of our nurses leave these shores, and nurses form the backbone. Doctors are important, but nurses form the backbone of any healthcare system, and therefore they have to be treated properly. In our time, it was recognized, and that nursing facility at El Dorado was opened in an attempt to increase the number of nurses and so on in the health sector. But that is a resource that needs to be encouraged, needs to be encouraged to remain in Trinidad, and we're looking at a flight of nurses to greener pastures. That's another discussion, but that's one of the factors, and we saw that come to hurt us in the COVID-19 pandemic, where there was an acute shortage of nurses. In fact, one of the things in this 𝗧𝗛𝗛 report speaks to a shortage of nurses, where one nurse was expected to look after 20 patients in the ordinary ward, and you had one nurse looking after 6 ICU patients. And that, in fact, could, in addition to the lack of resources, could have accounted for the increased deaths that we saw in the ICUs and so on. So that is a big issue, and we need to treat that in a more definite way. The other thing about this in the health sector is in terms of the doctors. Now, when this government came into power in 2015, there were about 400 unemployed doctors. I don't know if you recall that. Young doctors, out there having to find other ways and means to make a living. And these doctors could have been incorporated into the health sector, especially into what we call the primary healthcare sector, which is like the health centers and so on, where you would have people going to have their regular checkups. So in addition to dealing with the burden of chronic disease like diabetes and hypertension and whatnot, strokes and so on, you want to have something in place to try and prevent these things from happening in the first place. And that program, seems to be lacking under this government. One of the initiatives that we did under Prime Minister 𝗧𝗛𝗛 𝗛𝗘 was to extend the opening hours at the health centers. You may remember this initiative, which was put in place, where a significant number of health centers, we have 102 health centers throughout Trinidad and Tobago, and close to about 50 of those health centers, firstly, they were refurbished. The great majority of them were refurbished and upgraded and so on. But in addition to the physical upgrade, a decision was also taken to extend the hours. So why were those hours extended? Because people are busy during the day, working, trying to make a living, especially in difficult times. When did they get a chance to go in the health center and check the health, check the blood pressure, check the numbers and so on? They could have done that outside of working hours. Those health centers were open until 8, sometimes 10. That was the vision, and they were open on Saturday, and sometimes on Sunday morning as well. So you have to do, there's different measures, a whole set of measures that you have to do, because you have to stem the tide, you have to prevent the chronic disease, but at the same time, you have to treat what is there. So it has to be a two-pronged approach. And this is where the vision is lacking.
Doc, I just want to interject here. And I think it boils down again to the same issue we spoke about with the vaccine, is that the education, the public education that the Ministry of Health will be required to impart on the public is almost non-existent. So for him to come and say, well, non-communication disease is an issue, like if you know discovering that, and he want to make an intervention there, it doomed to fail from the start, because the public education not there for him to impart that knowledge. As you know, rightly stated to us there, a lot of things have to be put in place, and are not there, unfortunately. As you said that, I just want to recognize the efforts of Dr. 𝗧𝗛𝗘 𝗛𝗘 when he was Minister of Health in bringing that extended hour initiative there. Doc, I worked in the RHA, in one of the RHAs, and let me tell you something, lots of rural communities benefited from that extended hours, where they would not have been able, when they were working full time and they come home in the evening, they would not have been able to go and see about the medical issues. And by those extended hours, it actually helped a lot of people. But I want to ask you this question, Doc. Is there an issue with 𝗧𝗪 in terms of availability of CDAP drugs and so on? Because a lot of elderly people in society now is complaining that when they go to get their prescriptions filled, they're not getting the required CDAP drugs, and it actually impacting negatively on their health, because if they're not taking their medications on time, they're going to start to see symptoms coming back again for the ailments that they are suffering from.
𝗧𝗪, let me interject here. Doctor, hope you don't mind.
No, go ahead.
You would recall that Dr. Khan had set up, put some things in motion with 𝗧𝗪 with respect for pharmaceuticals to be distributed to the various hospitals and health centers. And in addition to that, I was sitting on a committee where we were going to computerize medical records. And with respect to the pharmaceuticals, there's a serious problem. While 𝗧𝗪 is saying that there is a shortage, yes, there is a shortage, but the shortage is not as a result of not having the pharmaceuticals. One of the big problems we have, and I had to face it at North Central, the government was owing the pharmaceutical companies millions of dollars for pharmaceuticals. So what was happening? I have a drugstore next door to me. I was the owner of a drugstore. What is happening? They have the drugs, but because of the fact that a lot of the pharmaceutical companies have been owed, the drugs are supplied to the pharmacies where they can sell it and they can get their monies for it. And this is why Dr. Khan, as you would know, was bringing the health card. When you get that health card, in fact, he introduced it on the 15th of August, 2015. And we started the health card system so that your records would have been in the card, and it would have been a swipe type system, so that patients, when they go to the pharmacies or the doctor or the health institutions, that card would have had information and with all the medical information and what you're using and what you're not using. So I wanted to interject to let you know. And coming back to Ebola, Dr. Khan, I was on the committee for Ebola. We had CORA prepared. We bought 2 new ambulances in North Central for just the usage for Ebola. We had everything in place. So we were prepared for Ebola, but this government was never prepared for COVID. I don't know if you want to agree or disagree with me or not.
Yeah, no, I think that's an important point. And you spoke about the health card and so on. So there are 2 issues with the drugs. I mean, and you see, it's an ironical thing, because patients go and sometimes they will collect supplies at one pharmacy and they will collect at another pharmacy. Now, why do they do that? Is it because they're greedy? Is it because they want to sell it? I don't think so. I think it's because they are so uncertain that when they go back next month, they may not get the drugs that they so need, that sometimes they resort to that. And of course, the health card was meant to try and correct that practice. But we surely have to be able to find a way. But again, 𝗧𝗪, to come back to your point, if you listen to the Minister of Health, you'll believe that there's no shortage of drugs at all in the country. But yet on a daily basis, I, as a member of parliament, constituents come to me at office and they bring their prescriptions, and I can see on the prescription written nil, nil, nil. So sometimes they are prescribed 10 drugs for those with chronic disease, and sometimes 2 or 3 they may not be able to get. So it's not a perfect system, and that is one of the issues that you have to treat. If you want to prevent this burden of chronic disease, you have to ensure, first of all, prevention, and then early treatment and appropriate treatment. One of the other issues I just wanted to raise again, and it's something that you have to think outside the box. You have all of these doctors, and again, we are facing a problem where the COVID-19 pandemic now is receding, and you had many of these doctors who were employed just for COVID-19. And one of the recommendations in the 𝗧𝗛𝗛 report, they speak here of something called a chronic disease death burden. And one of the recommendations of this report to the government is to ensure that those additional doctors who were employed during the pandemic would be retained to be able to treat with the chronic disease, meaning that these doctors now should be employed to go out in the health centers in primary care. And there's also another thing that can be done, and I mean, this is something that we as a country need to recognize. We do have a problem in terms of hypertension, diabetes, and so on. And one of the things, now I see the minister blaming people and say, you don't understand why people don't do this and the other and so on. It's not about blaming the population. It's about trying to do things to facilitate it and make it easy. One of the things you can do is you can have a pool. Some of these doctors who are unemployed, you can employ them, have a pool. You can have people call in their blood test results. You can call in their cholesterol, their blood pressure readings, and so on, and get some basic advice, as to whether to seek health care. Those are innovative solutions, that can happen. Every household should have a blood pressure machine. And maybe, this is something I had raised, that is a cost-effective measure. Whether it is provided, whether it's a reduced rate or a household and so on. And you link it now to making sure that if you get the machine or you get your blood sugar machine, that you call back in the results. You must be able to call back in to a professional who can then advise. And those are some of the ways we can look at addressing some of these issues.
Okay, just doing a quick time check. It's 9 o'clock. There is one question on the chat, and then I believe Chris has a question to ask. And then Dr. Bodo, probably we could give you a chance to make your closing remarks. I know there's some things you want to share with us as well. Right, the question on the chat here, this is from Harry. There is a need for patients' charter to empower citizens to challenge the care being provided. It should allow for citizens to demand face-to-face inquiries with the administration and medical staff. So Harry wants to know, what is your position on a patient's charter?
Right. No, I agree that there should be a patient's charter. In fact, I think currently there might be a patient's charter. I'm not sure if it comes from the Ministry of Health, but some of the RHAs have a patient's charter that allow you to make a complaint. But it is not as detailed, and it doesn't allow the patient the rights that the patient's entitled to. One of the complaints that is most common in the health sector is the fact that when something goes wrong or patients perceive that they have not received adequate care, they don't have redress to the system. So again, I can't speak on behalf of the party in terms of making policies, but what I can say is that it's something I'm sure that the UNC government would look at in terms of implementing and ensuring patients' rights. Chris alluded earlier to the fact of health being a right, and even included legislated for in some countries and so on. And so in that regard, I would certainly be in favor of a patient's charter. And even to go further, you see, it's all well and good to allocate $6 million a year and whatever happens, but that's not good enough. The patient's charter must also, and again, this is where you have to have the RHAs accountable. The patient's charter must also say, well, listen, we guarantee you that when you come to casualty for an urgent condition, you will not wait more than a certain time. You will not wait more than a certain amount of time for your surgery. You will not wait more than a certain amount of time for your clinic appointment. And if you have to wait beyond that, then the government will put in place other measures to deal with that. And we had started that. We started that with something called the External Patient Program. So in a way, the People's Partnership Government, again, was doing things which was akin to protecting patients' rights. The External Patient Program, which you may remember, was designed that if you were waiting for more than 4 months for an MRI or a CT scan or an ultrasound or some intervention, that you were allowed to have it done outside of the public health sector, and the government would pay for it. And that way, you would cut into the waiting time in a realistic way. I mean, in the current system now, people are waiting months, for investigations. By the time you get the MRI or the CT, it might be too late. Some people are waiting, for example, for cataracts, and so they're waiting a long time for eye surgeries. There are many things I can go into. We don't have the time, of course, to show where patients are suffering. And this so-called parallel healthcare system that was so much spoken about, was that a parallel healthcare system? I know we are running short of time, but that is something that we need to look at. We were told that there was going to be a parallel healthcare system, when in truth and in fact, the doctors from the normal hospitals were moved to the COVID facilities to work in those facilities. And as a result, the normal care of patients did not continue in the hospitals. And now we are facing a big backlog with regards to clinics and clinic appointments and surgeries and so on. But that is, for another day, another discussion. But that was also a myth by this government that they boasted of this parallel healthcare system. When in truth and in fact, it was one healthcare system, the COVID-19 system, and doctors were just allocated and moved from one hospital to another. And so that was an issue.
Let me firstly say, and I want to commend the MP for not just coming on here and speaking the PNM. I think he provided a lot of solutions, and I think it is very innovative. I have some friends who just graduated and they got placed on contracts in the hospital and they are overworked. I'm asking them to go on Lyme and they don't have the energy to, but I know there's this notion that the private healthcare system is very different to the public healthcare system. I know that I could attest to that, having been a part of both and experiencing both. I want to know how we can fix that, but also, is there a move to digitize the healthcare system? And the reason I'm asking is my doctor, my private doctor, I can send him WhatsApp messages and he will give me he would do his consultation there. I could call him, video call, whatever it is, and that space fits. So instead of me having to go in for a checkup or whatever the case may be. And so my question is, are things being digitized now? Are we there yet, or should we go there? Is Trinidad and Tobago ready for that? Do we have the digital infrastructure for something like that?
Yeah, well, the move is on to do it. It has been in the pipeline for a long time. One of the issues is that one of the things that will benefit the most is the issue of medical records. Yes. And the transferability of medical records. So many times the patient will come from the health center to the hospital, and the doctors in the hospital may not have access to medical records, and vice versa. And of course, that will make life much easier. Chris, you spoke about the use of WhatsApp. Again, it's the same thing I was alluding to in terms of employing doctors. And patients can send their information via WhatsApp. And of course, there are certain safeguards and so on you have to take in terms of patient confidentiality and how much advice you can give on a phone. But there's certain basic advice you can give very safely using technology, using the WhatsApp and so on. And even the issue of telemedicine. I mean, I'll give you a simple example. I mean, I'm a gynecologist, I'm a surgeon. A patient, I may have done a surgery. A patient will say, listen, doc, I have a noticeable swelling, by the cut or something. Now, before, I would tell the patient, you have to come in, I have to see it. So now the patient will send a picture. I will look at it and I can determine, listen, this is serious or is not so serious. And so it helps. Again, there are certain medical legal issues with regards to that. It's not suitable for everything, but it can make a big impact in terms of patients having to come and physically wait to see a doctor in the public health system. And a lot more use could be made of telemedicine. To some extent, it is already available in the public health system. Things like reading reports for X-rays and ultrasounds and CT and so on, that is done. Some of those things are done, via that. But we still have a long way to go in terms of the health sector being fully digitized. But that is the direction in which we have to go.
Okay, well, I'm saying it is 9:07, right? I know Alim. Alim, can you make it quick? Would you be able to make it quick? Alim, hello? Okay, well, I don't know. But anyway.
Yeah, okay, I hear you. Okay, what I was saying, that what Dr. Buru was saying, this is what we have started in Mount Hope, starting to put the medical records into the computer system, and all that stopped after we left. And he's correct. Once everything is in the system, it will make life very easy for everybody, right? So I want to compliment Dr. Buru. It was really a pleasure working with him in Southwest and North Central, and we had very long discussions, and we shared a lot of information during that time while I was in North Central, and he's a very brilliant doctor, I must say.
Thank you, Ali.
Okay, thanks for that. Well, I think we can close off for tonight, but I just want to let you all know that there will be a part 2 and a part 3 and so on. The health sector is in fact very important. And so we are kicking off actually our first, the state of the health sector part 1 tonight. But in the coming weeks or maybe a few months, we will have a part 2 and a part 3. So we will continue discussions, and hopefully Dr. Bodo can join us again on those sessions, right? Dr. Bodo, I want to say thanks. I mean, I want to express the same sentiments as Chris. It wasn't just let's bash the PNM, right? You did offer us a lot of solutions, a lot of initiatives for paving the way forward. And this is what we're about, right? I want to give you the opportunity to make your closing remarks. And I know there was some stuff you wanted to share with us as respect to precautions we can take in the flooding from a health perspective. So the floor is all yours.
Yeah, thank you, Alicia. So I also want to commend the Compass Foundation for the quality of discussion and the direction in which you're taking the discussion. I like the notation of critical conversations. All of these are critical conversations. And I urge you to encourage this direction because, again, it is about improving the country, improving Trinidad and Tobago, and in the health sector, education sector. Those are sectors that are non-political. With regards to the flooding, I just want to, to ask the population, urge the population to be cautious. I see many of my colleagues out on the ground. Dr. Ragbe, MP Parry, others in the eastern and central and so on, where it's been very hard hit, and working on behalf of their constituents. I want to commend them, for those efforts. But also to point out to citizens the risk. Now I see these floodings, the waters take a long time to recede, and to be aware of the dangers of floods. Not only of, I see pictures of people driving into floodwaters to quite a depth. So in addition to the risk of loss of life, there's also the risk of disease. You can have things like gastrointestinal disease, leptospirosis, and so on. So just to be cautious in terms of how you handle, what you handle, from the floodwaters, and be very cautious with regards to your health in these circumstances going forward. I'm sure a lot more will be said about that in the coming days. So
okay.
Again, So I just want to close that, and I want to thank you for the opportunity. But I agree with you, Nisha, there's a whole lot more that needs to be said on the health sector. And I would be very happy, to join you again, if you so wish in the future. So I thank you for the opportunity.
Safraz, and then maybe Chris, you can close off.
Yeah, well, Doc, I just want to thank you for those points. I mean, we learned a lot from you and clearly there's something wrong with the health sector. I think leadership has a big role to play. And if the current administration is making the wrong decisions in a consistent manner, then eventually the system will start to suffer, which is what we're seeing here. My personal opinion is that I think a lot more lives could have been saved during that COVID time. We hear stories about gas running out in the temporary tents that is set up and so on, and that's the oxygen gas that is, and a lot of patients were suffering and so on. So there is something wrong with our health sector. No pun intended, but no amount of plaster to cover it will hide it. People are suffering outside here, and Doc, people like yourself who can make that difference and educate us. I am so thankful for you joining us tonight here. We learned a lot, and definitely look forward to seeing you in another edition of this series. So thank you very much.
Thank you.
MP, I really want to thank you for coming on the Compass. And, you know, when we set out our agenda for this Facebook Live, the show, and well, now I see we're on YouTube as well, it was to really have that productive conversation, because in politics, sometimes the noise, the intense levels, you can lose the substance and the content and what really is the issue. You know, we had Robin Montano on a few weeks ago, and he said that, are you serving the people? And that's really what it is about. And so I am very pleased with tonight's discussion, and I really want to compliment you and commend you on how you articulated yourself. And we observed the way you articulate yourself as well in Parliament as it pertains to the health sector, because again, Trinidad and Tobago, health is a very serious topic. It's not a topic that you could just say anything and everything about. It is not a topic that we use as a political football, as some you want to use it as. It's a very serious thing, you know. Your health is your wealth. So I'm looking forward to a part 2 of this discussion as well. And thank you for joining us. And good night to everyone listening and viewing.
Good night, everyone. So we'll see you all. Oh, just to make a little announcement, we have moved now to Sunday nights at 8. So we will see you all next week, Sunday at 8 p.m. So stay safe and take care. Good night, everyone.
Good night.